Today I'm here to provide an update on the acceleration of Alberta's vaccination program. I've said before that we are in a race between the vaccine and the variants. Right now, the variants are winning that race. The third wave is hitting us hard, and cases continue to rise sharply. Last week, Alberta implemented aggressive but necessary measures to keep people safe and to protect our healthcare system by returning to step one of the four-step framework to protect the health system and reduce the rising spread of COVID in our province. These measures are designed to buy us time to get enough Albertans vaccinated so we can finally get through this thing and get back to normal this summer. Vaccines remain our best hope. We have, I believe, one of the best programs in Canada, and I'm pleased to say that as of yesterday, more than 850,000 doses have now been administered. More doses means catching up to this variant spread, and once the vaccines beat the variants, we get our freedom back. I shared this slide last week, and it's worth highlighting again. Every day, tens of thousands more people gain immunity to the virus through the vaccine rollout. In the coming weeks, we'll be able to say that almost a quarter of Albertans have some degree of immunity either through the vaccines or from prior infection. By the end of May, it's expected to be almost half with that level of protection. And by the end of June, we anticipate that about 2/3, and by mid-September, almost 3/4 of Albertans will have protective immunity. We're nearing the end of a long and tiring journey. It is our path to recovery and freedom. Right now, we're in a transition period, fighting to keep control of the virus just a little while longer until it's vanquished by vaccines. As more people become immune, we'll be able to get back to normal faster. When about half of us have immunity, we're hoping to be able to raise capacity limits for gatherings. We're anticipating that we'll be able to gather together in larger groups, and while some restrictions may remain, but not anything like right now. Once 2/3 of us have immunity, we'll start to feel back to normal. There'll be no formal restrictions, stampede, sporting events, other festivals will be possible, especially if outdoors, likely with certain public health precautions. Masks and distancing will be part of our lives, but only encouraged and not mandated. Then, once 3/4 of us are immune, we expect we'll be fully back to normal. But all of this relies on the supply of vaccines, and thankfully it's finally increasing. In the last couple of weeks, Alberta's received more than 500,000 doses of vaccine, and we expect to receive another 250,000 this upcoming week. With supply increasing, Alberta's government is expanding distribution of doses at a record pace. In the last week, Alberta's undertaken multiple steps to increase vaccine distribution. We fully opened Phase 2B to more than 650,000 eligible Albertans who have underlying health conditions. We opened bookings for the AstraZeneca vaccine last week for Albertans between the ages of 55 and 64. We opened Phase 2C to more than 240,000 healthcare workers with bookings starting this morning. And we opened rapid flow-through clinics in Grand Prairie, Fort McMurray, Red Deer, Lethbridge, and Medicine Hat. And I'm pleased to announce that today we're opening huge rapid flow-through clinics in Calgary and Edmonton. I joined Dr. Hinshaw and Mayor Don Iveson to tour the Edmonton Clinic this weekend at the Expo Centre, and it's a sight to behold. Supported by hundreds of healthcare workers, both the Calgary and Edmonton clinics will be able to administer up to 1,000 doses per hour and 6,000 per day in each of those two mega clinics. This is a huge addition to our vaccine program. So starting at 12:30 this afternoon, in just over an hour, the Edmonton and Calgary Rapid Clinics will begin inoculating people between the ages of 55 and 64 with the Oxford AstraZeneca vaccine. In addition, we now have more than 1,300 pharmacies and 103 immunization sites administering the vaccine, and more coming on board in the coming weeks. The province is now on pace to administer more than 300,000 life-saving vaccine shots per week. Our stretch goal is to administer upwards of 500,000 a week, But all of this will depend on how many people come forward to get vaccinated. And particularly, we're concerned about potential uptake on AstraZeneca. So we'll have to wait and see, but the capacity will be there to deliver. We expect to receive more than 119,000 doses of Pfizer vaccine every week until early June, when this should jump to more than 225,000 a week. We'll also receive more shipments of Moderna vaccine and hope to get the first shipment of Johnson & Johnson vaccine by early May, though we're still waiting for a specific date from the federal government. The benefit of that vaccine is it's a single-dose protocol. As more doses arrive, we will keep accelerating our rollout. Starting today, select participating pharmacies will also be allowing walk-in bookings for eligible Albertans aged 55 to 64 for shots with the AstraZeneca vaccine in Edmonton and Calgary rather than just by appointment. Over 684,000 Albertans have now received at least one dose of vaccine, helping to protect them from severe outcomes and reduce the spread of COVID-19. Alberta Health and the Alberta Medical Association are working together to incorporate physician clinics into Alberta's vaccine program. We'll have more to say on this soon. All adults in Alberta will be offered a first dose of vaccine by the end of June, provided that those doses arrive as scheduled.